Hey there, I'm Dr. Anthony Dakpallah, your radiologist. Last time we talked about mammograms, who needs them, what they show, and why they are so important. But today we are about to talk about another powerful tool, which is the ultrasound, breast ultrasound. What exactly is a breast ultrasound? When do you need one? And no, it is not better than a mammogram. Let's clear that up in plain language. So, what exactly is a breast ultrasound? It's a scan that uses waves to look inside the breast. No radiation, no injection, no pain. We just apply some gel to the skin, use a small probe, and the machine shows real-time images of the breast tissue. It's quick, it's safe, and especially helpful in some situations. So, when do we use it? Here are some common reasons we use a breast ultrasound. So, you may feel a lump in your breast and you may be wondering what it is. An ultrasound is an easy way to help us figure that out and to help us know whether this lump is a solid mass or it's a fluid-filled cyst, which is usually a benign condition. We also use it as a follow-up for mammograms. So sometimes mammograms pick up a lesion and we are not sure of what this lesion is. So we may recommend an ultrasound for us to further assess the lesion to know exactly what it is. Also, when we are younger than 40 years in some jurisdictions, 30 years, in some jurisdictions 35 years, we may do an ultrasound rather than taking you to do a mammogram. Reason being that younger people have denser tissues and these tissues are more susceptible to radiation, and so we prefer to do an ultrasound rather than a mammogram. Once you are above 40 years or in some areas 35 years, we can go ahead to do a mammogram. And this also depends on your history. Based on your family history and other histories, we may choose one or another. Also, if you are pregnant, we may decide to do an ultrasound rather than a mammogram, or you are breastfeeding in some instances. And also, when we do a mammogram or we realize that there's a lump in the breast and we need to do a biopsy, we may recommend an ultrasound to help us guide the needle to wherever the lump is. So that's what we call an ultrasound guided biopsy. So let's clear the myths that we hear from time to time. The first myth is that ultrasound is better than a mammogram. So there are different things. Ultrasound is great for certain types of lumps and dense tissue, but it cannot see very tiny calcifications, which are sometimes the first signs of cancers. And mammograms can see these. So it's not about choosing one over the other. It's about using the right tool at the right time and sometimes using both. So is the scan painful or do I need to prepare? Ultrasound scans are not painful. We don't use injections for ultrasound scans either, unless we are going to do a biopsy, and we'll talk about biopsies later. But for a routine ultrasound scan, we don't do injections. Also, you don't need to fast for an ultrasound, or you don't need any special preparation for an ultrasound. All you need to do is that you lie down, you take off your bra and your top, and then we apply some gel, which nowadays, in the past it wasn't warm gel, but nowadays we have machines that warm the gel up for you. And the scan takes about 15 to 20 minutes and we are done. So the second myth is that if I had an ultrasound, I don't need a mammogram. And this is not true, especially if you are over 40 years. Ultrasound can miss early cancers that mammograms pick up. So if you are in the screening age group, both might be needed. So what if I have dense breast tissue? If you've had a mammogram, reports say that you have dense breast tissue, there is no need to panic. It just means that there's more glandular tissue in your breast than fats. And it's common especially in younger patients. So the younger you are, the denser your breast tissue would be. And dense breast tissue makes it harder for us to see certain lesions on a mammogram. So that's why they may tell you to go ahead and do an ultrasound just to clear things up. So a recap, breast ultrasound is helpful when you feel a lump, you are under 35 or in some jurisdiction 40 years, you are pregnant or breastfeeding, you have dense breasts, or you have a biopsy planned for you. It is fast, it is safe and very effective, but it's not a substitute for a mammogram. So, is breast ultrasound important? Absolutely. It's one of our best tools for checking lumps, guiding biopsies, and helping in special situations. But remember, it doesn't replace mammograms. This Pink October, remind the women in your life to get screened, ask questions, speak up if something doesn't feel right. You deserve peace of mind in this life. Like, comment, and subscribe. And stay tuned for episode 6, which is Why Did They Call Me Back for My Scan? We will unpack what that means and when to worry or not to worry. Until then, stay safe and stay healthy. Have a nice day.